regular but still remote meeting of the Burlington Board of Health to order. It has been now more than a year that we have been meeting remotely. We thought the COVID pandemic was beginning to wane. However, it looks like we're seeing an upsurge. I have no idea when we'll be able to go live. I was hoping weeks, now maybe some months. We have a new Board of Health member. Congratulations to Andrea Sheehan becoming a member of this board. And she has agreed to represent us all in reciting the Pledge of Allegiance. Please, Andrea.
Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you so much. I'm Ed Weiner, Chairman, and remotely with me this evening are board members, David McSweeney, Vice Chair, Andrea Sheehan, our new member, Mary Beth Welch, member, and this evening, Dr. Wayne Salzman will not be attending this evening's meeting. Also with us are Susan Luminello, our Director of Public Health, Christine Mathis, our Environmental Engineer, Sarah Portamash from our Board of Health Administration, and our host, and Dawn Cathcart, Recording Secretary. I want to thank you to all the outstanding BCAT professionals who work so hard to make this program and many other news programs possible. We are still operating in a declared state of emergency with special rules for public meetings. Mr. McSweeney, the Board of Health Vice Chair, will provide the legal requirements for tonight.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 38, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance. Other members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in this order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by tuning into the BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook Live feed, or over the telephone at 408-418-9388, meeting number 129-206-9240. That's 408-418-9388, meeting number 129-206-9240. Also, we will be monitoring the comments on Facebook Live to see if there are any that the board may wish to address. And as a reminder to all the board that votes are required to be done by roll call for this virtual meeting. And with that, it's back to you, Mr. Chair.
Thank you, Mr. McSweeney. Again, please note we're live on BCAT and available for comments and questions through this video technology. As I note every meeting, remote meetings and chairing remote meetings are not easy. Preparation is many times that of an in-person meeting. Please understand, we are all doing the best we can, and we're all in this together. Before we move on, I want to introduce our newly elected board member, Andrea Sheehan. Andrea, I want to give you a minute to please tell everyone about yourself, your background, your interests, and any objectives or goals that you have for this board.
Sure. Thank you, everybody. And I just can't tell you how excited I am to be here and to be working with all of you. And I also want to thank everybody for their support and their votes electing me to this position. I've been a Burlington resident for 32 years. My husband, Kevin, and I moved here, and we have 3 grown children. All of them have gone through the Burlington Public School System. 2 of them still live in Burlington, and I have 4 grandchildren ranging from 6 to 1 month old. So I've been here for a long time, and I really love the community. The reason I ran for this position is I recently retired from Hewlett Packard Enterprise after 37 years of employment. I wanted to volunteer and get involved, and I've always had an interest in healthcare. I really like advocating for people, and I just really wanted to get involved. So I'm delighted to be here, and I am really looking forward to learning from all of you and helping where I can.
Thank you so much. We're very glad to have you. And congratulations.
Thank you.
We now have approval of minutes from March the 9th, 2021. If there are no errors, omissions, or additions, I'd like a motion for approve.
So moved.
I have a motion. Do I have a second? Mary Beth, are you on mute?
I just second. Yep.
Thank you very much. So it's a motion by Mr. McSweeney, second by Ms. Welch. All in favor? David McSweeney,
Aye.
Mary Beth Welch,
Aye.
Andrea Sheehan, you're going to
Aye.
abstain. You abstain,
Oh.
abstain, please.
Abstain?
Okay, thank you. And I will vote yes. So it's 3-0-1. And now for the approval of minutes for March 23rd, 2021. Are there any errors, omissions, additions? If not, I'll entertain a motion to approve March 23rd, 2021.
So moved.
A motion by Mary
Second.
Beth Welch, second by David McSweeney. All in favor? Mr.
Aye.
McSweeney?
Aye.
Ms. Welch?
Aye.
Ms. Sheehan? She's abstained, and I vote yes, 3-0-1. Thank you so much. Which brings us to citizens' time. Is there anybody on our line that would like to speak to this board who are not on the agenda? Ms. Kurtamash, do we have anybody? We do not, so we will move on. Thank you so much. As we have a guest this evening, Mr. Patrick Larkin, who's the Assistant Superintendent of Schools, who will provide an update to this board and to the community on COVID-19 and our school system. I'm going to ask for a motion to take his presentation out of order so he can attend tonight's school committee meeting. Do I have
So
a motion,
moved.
please? A motion by Mr. McSweeney. Do I have a second?
Second.
I have a second by Mary Beth Welch. All in favor? Mr. McSweeney,
Aye.
Mary Beth Welch,
Aye.
Ms. Sheehan,
Aye.
and I vote aye, 4-0-0. Mr. Larkin,
Hi, Dr.
the
Weiner.
floor is yours. Thank you so much for coming.
Thanks for having me. Just again, it's been a little while. Thank you for your continued support, and particularly Susan. Susan and I thought maybe back in February, we had started to limit our communications a little bit, and unfortunately they've picked up again. So we're, as maybe noted, we saw an uptick in cases at the high school over the last few days, which prompted us to have the high school go remote this week. At the same time, we're happy to have our elementary students back in school for full days, and that's been going very smoothly thus far. So knock on wood that continues, and that we don't see any uptick anywhere else in the district. I know there was a slight uptick in town last week. So again, we're hoping that we're not going to see any more, see the numbers go any higher, and we're just trying to encourage our teachers and, of course, community members to continue to use mitigation that's gotten us this far. We're also happy to report that a lot of our teachers are in the process. They've either just gotten their second vaccinations, or they have their appointments scheduled in the next week or so. So that gives us, an extra feeling of comfort knowing that our teachers have received their vaccinations. So that's just a quick update. Again, I'm sure there are questions that you may have for me, since it's been a little time since I've been able to join you.
Thank you very much. Members of the board, do you have questions for Mr. Larkin?
Mr. Chair, if I may?
Please.
Mr. Larkin, thanks for attending. We always enjoy you having us as part of our meeting, so I appreciate you attending today. Um, the state rolled out earlier this month at the elementary schools. I think it was April 5th, and then we had a staggered rollout for the rest of the levels in schools after that. Can you talk about a little bit about your plans as far as getting in, the kids back into school? And I don't think the Board of Health has seen those plans. I'd like to understand, kind of things that you may have done differently, or what you did as a precursor to the kids joining back us at school.
Sure. So one of the things, as people may or may not know, the state did stagger the returns with the date of April 5th was the return. The state wanted all elementary students back for a full day. They've given us the date of April 26th for the Marshall Simons, or for the middle school kids to be back for a full day. And the high school, no concrete date has been given by the state, but I'll tell you what our plans are in Burlington. So when we got the message from the commissioner back in March, I think it was, that they wanted the elementary kids back for a full day, we sent out a survey to the community. As you know, we have over 400 elementary students that have chosen to be remote this year. So we gave those families the opportunity to decide. Well, we gave both families an opportunity to decide if people were in person and wanted to go remote, or if people were in remote and wanted to come back in person. And at the end of the whole survey process, we had about the mid 40s, the number of elementary students that were in the remote academy that were going to choose to come back to their home schools. We were able to get all of the requests back into their home schools. So say if it was a Pine Glen student that was in remote academy, they were able to return to Pine Glen. We were also typically, most cases, we've added one student to a classroom. About half of our classrooms had students added, where again, we had 6 feet of distance in all of our classrooms prior to kids coming back. And in a few cases where we've had individual students added, we may have gone just under 6 feet, but we're not near 3 feet at all. We've communicated with families and with teachers if they now have a classroom where students may be less than 6 feet. But again, the state guidelines and the CDC guidelines have now said that 3 feet of distance with mitigation with masks is an appropriate distance in the classroom. But we've come nowhere close to that in our elementary schools at this point. We've also taken precautions if there are classrooms where students are within 6 feet, under the 6 feet distance, then we've made accommodations for lunch for them to go to a different space where they can have that 6 feet of distance. Because again, when the masks come off, we want to make sure that we have that distance for students when they're eating their lunch. In some cases, classes have been going outside when the weather's been good enough. So those are just a few of the things. The busing again at this point, we haven't opened up our busing for any more people to get on the bus. We're going to continue to monitor that, and that may change in 2 weeks. I'm talking about busing for elementary students.
Right.
When the middle school comes back after vacation, we will be combining cohorts, so there will be more students riding buses at that time, obviously, when the cohorts are combined. And there may be classrooms, again, that are under 6 feet. And again, families and teachers in those situations are made aware of that. In the high school, we're looking at May 3rd for the return of all cohorts to the high school, combining cohorts. And one of the two reasons really that we pushed that back, we were initially thinking April 26th, but 2 reasons with the recent uptick. And also on May 3rd, a lot of our seniors will be out on internships. So that takes a good number of students out of the building. And we thought that was helpful to not, if we can remove, density from classrooms, like not having too many students in one place and dealing with lunches and traffic, we thought, again, where we're seeing a slight uptick, to wait that extra week made a lot of sense. So that's, again, a quick update, and I'm happy to answer any questions.
So thank you, Mr. Larkin. I appreciate that. Excuse me. I would just, and great plan, and certainly you guys have done a great job throughout the course of the school season so far. I know it's been a challenge for you, so I appreciate the efforts around that. I would just recommend or enforce that we're here to help you. So if there are things or things that come up along the way, and or you need help in making sure that we're enforcing any of the plans, because we do get calls here at the Board of Health regularly about the students. I'd recommend let's stay lockstep, tied at the hip as we move forward, because I know it's we're kind of sailing through uncharted waters. So I would like to see more involvement as things come up. So please keep us in the loop as things do go along here.
I appreciate that. And just that makes me think of what happened this weekend. So I just want to apologize to the Board of Health. Susan's been great about staying in connection with us, Mrs. Luminello, and anytime we've needed her. And I dropped the ball on circling back before the call went out to families that we were going to go remote for Monday. And I don't want any surprises to you about what's going on in the schools since you've been so supportive. So I just want to apologize publicly for missing one step in the communication on the school side, to not let you all know. Again, thanks to your great partnership, we've been able to make these thoughtful decisions, and we didn't return the favor in that case. So my apologies from the school district side.
Thank
Thank
you.
you.
No more missed questions. No more questions from me, Mr. Chairman.
Mary Beth, do you have anything?
Yeah, just one, and it in regards to, I know you shared with the elementary and middle school, and some folks may not know this, but for the high school students, the options, if are they still remaining the same if they were remote, that they'll still remain remote? That's what I thought. Just wanted to
Yep.
to
Any
say that.
families that would like to stay remote, that's still on the table. Yes. Thank you for asking.
I thought, yep. Thank you very much. Thanks for sharing that. Thank you.
Andrea Sheehan, do you have anything that you'd like to ask?
Nope.
Okay, thank you. Thank you. I have one question, and I do monitor social media just to see and to keep informed with all of the sites, and there's a lot of discussion around sports, specifically high school sports. Can you give us a quick update on what the plans are? Because there was a lot of banter, and also what the school is doing to keep our student athletes safe.
Sure. Thank you for that question. As you know, every sport brings its own kind of unique attributes that could potentially put students in more consistent contact with one another. So again, we get questions about different sports, and if parents see something, uh, we just keep trying to reiterate to the coaches that the kids should be masked and that we want to maintain that distance whenever possible. Um, and so again, we haven't changed a lot. I think the only thing we've seen is potentially, warmer weather's coming. We were all in high school at one point. And again, one of the great things about being on a team is like the camaraderie you have during and after, and you tend to be closer to your teammates for lengthier periods, and just encouraging students to continue to be conscious of that. Again, we're seeing potentially some new variants that may be more transmissible, and some of the things that have gotten us to this point may not be as successful as they were in the past. So we're just trying to remind people to be vigilant. Actually, Dr. Weiner, there's not any magic to it except reminding kids how far we've made it. And we certainly have concerns that, again, the group that's going to still be unvaccinated for the near future is those teenagers. And if we're trying to watch the trends that we're seeing around the country and encourage families. Again, we've made it this far. Don't let your guard down. We're going to try to do this safely and have kids have fun. But even little things like riding to, I know we have some teams that they're not necessarily Burlington High teams because they're not in season, but we have groups of kids that go play basketball together at this point that are all members of our team, but it's not an official sport. And we've seen some things with that, like if you're carpooling, like even those types of things you may want to avoid. And if you're going to do it, just to stay masked. So we're just trying to give the reminders that we've been giving since this whole thing started. And there's really haven't been any huge dramatic changes. We're glad we're talking about outdoor sports at this time as well as the weather warms up.
Thank you very much. I'll just open it up now. Christine Mathis, our Director of Public Health, Susan Luminello. Do either of you have any questions? Susan?
I don't have any questions. I just want to thank Patrick for all the work that he does. He really puts in a lot of time, making sure that we get the contacts on time. That really helps because when we get in it, it's accurate. And when we get them on time and it's accurate, we get people into quarantine as soon as possible. And so I think we have a really good system down now. I mean, we've been doing this all year, but we really polished it up a bit to get people in quarantine quickly. And I just want to thank him for all the work he does.
Thank you. Sarah, do you have any questions? Or is there anybody on the line that has any questions or have called in? I know people are watching. Nobody? Nobody, Mr. Larkin, thank you so much. The silver lining, if there's anything of that in the pandemic, is that we got to meet you and spend some and to get to know you a little better. And I want to thank you for your excellence, your hard work, everything that you and Dr. Conti has done. I talked to our school committee chairperson multiple times a week, and I always sing your praises. Thank you so much. I will probably ask you to come back the first meeting in May, and so why don't you plan on that? And thank you so much.
No problem. And if I could just say one more thing, I appreciate Susan's kind comments. And we have a whole staff of nurses that are working overtime to make sure we're following the cases in our district. And I don't know how Susan and her staff have kept up with the numbers at the town. It's amazing. So I know you know how hard she's working. So I want to just return the favor. And if people don't know, it's unbelievable. The amount of work that you've had to do on your side to help support us. So thank you for that. And we look forward to continuing our collaboration. Hopefully not as frequent, but we definitely have enjoyed getting to know Susan and the staff on the Board of Health side. So thank you.
Thank you so much for coming. Be well, be safe, and we look forward to seeing you again. Thank you. This will bring us to the chairman's report. It's probably a good time to thank everyone, the Board of Health members, our professionals and support staff, for all that you've done over the past year. A past year. To keep our town safe, to do all that you have needed to do on weekends and nights. And I happen to laugh at Susan Luminello's report where she says discussions with Ed Weiner, multiple. Susan, you'll be happy when this is all over. We are still in unprecedented times. In lieu of an update tonight, I want to say a few words about the passing of a very important leader within the town of Burlington. Last week, this community lost Eugene, Terry as we all called him, McSweeney. For more than 3 decades, 37 years, Terry was a member of this board. Next to his family, the Burlington Board of Health was the most important thing in his life. His work was a labor of love, guiding the appropriate development of this community, ensuring that this town was safe for everyone who lived here. Never backing down, advocating for all. There was never a question that it was his town, his Burlington, the place he cared so much about. To his family, especially to his son David, our vice chairman, on behalf of this board, I offer our condolences. Your father will be missed. Terry McSweeney, however, will always be remembered as part of Burlington's history. I ask for a moment of silence. Thank you very much. This will take us to permits. We have a permit for the keeping of animals, a request for 3 chickens. Susan, will you presenting this or will our environmental engineer? I don't want to go foul here.
Yeah, yes, I will. So, Mr. Branicki is here to request a permit for the keeping of 3 chickens. Our Associate Health Inspector, Samantha Hardy, went out and did an inspection, saw where he was going to keep the coop, reviewed all of his plans, and has no objection to this permit being granted. And I know Mr. Branicki is on this call. I don't know if he wants to add anything.
Mr. Branicki, can you just tell us what you want to do?
Hi, everyone. Thank you for hosting the meeting and allow me and my family to attend. We'd like to, so we have a toddler who's 5, and we've been looking already a couple of years ago to have chicken as a way to educate our children, how, where our food is coming from. We have a garden, and then the will to have chicken grow and grow more. So we decided to move forward with that and be able to reuse our food and reduce our waste, but also have our chicken produce eggs and then use the manure for our garden as well.
Thank you. Mr. Branicki, no roosters. As
No,
you know.
definitely no roosters. I grew up with roosters and never again.
Thank you. Does anybody have any questions for Mr. Branicki?
Mr. Chair,
Yes.
not necessarily any questions. I just be interested if there's any abutters on the phone that need to speak in
Yeah.
favor or against this at all.
Yeah, you beat me to the punch.
Oh, sorry
Susan,
about
are
that.
there any abutters or Ms. Cortamash, is there any abutters on the line here?
I'm not certain if they're abutters, but if either of the 2 individuals would like to speak, please unmute yourself.
Susan, did you get any calls or any communications?
No, we did not.
Okay. I guess none of these individuals are abutters who would, or anyone who would like to speak. I guess there are none. So I would entertain a motion, please.
So moved.
I have a motion by Ms. Welch, second by
Second.
second by Mr. McSweeney. Any other discussion? If not, all in favor. Mr. McSweeney,
Aye.
Mary Beth Welch,
Aye.
Andrea Sheehan,
Aye.
and I vote aye, 4-0. Mr. Branicki, you will get a permit. Thank you for coming, and we wish you well.
Thank you very much.
Terrific. Under discussion, our next topic is reorganization of the Burlington Board of Health. As we don't have a full board tonight, I'm going to ask that we postpone our reorganization this evening until we do have a full board. That has been the custom and what we have done in the past. Could I please have a motion to postpone the reorganization to our next meeting?
I'll make a motion to postpone the reorganization of the Board of Health until our next meeting.
Do I have a second?
Second?
I have a second, Mr. McSweeney. All in favor, Mr. McSweeney,
Aye.
Mary Beth Welch,
Aye.
Andrea Sheehan,
Aye.
and I vote aye. That is 4-0. Thank you so much. Wow, we've moved very quickly tonight, and we are at staff reports. And our first is the environmental engineer. Christine Mathis, would you like to give us a quick summary?
Sure. Good evening. I wanted to just remind the board and residents that Household Hazardous Waste Collection Day is coming up. It's on May 1st. It'll be held in the usual place at the Francis Wyman Elementary School, 41 Terrace Hall Ave, from 8:30 to noon. You can visit our website at burlington.org for information on what you can and cannot bring, and also important information about COVID precautions that we will be taking at this event. It'll be a contact-free event, as we request that the public participating remain in their car, keep their windows rolled up at all times, and put their wear masks and put the waste to be removed from their cars at the rear of the car, either in the trunk or in the hatch section or the bed of the truck. As I said, all of this is outlined on our website, or you can call the office if you have specific information requests. In addition to my normal functions, I concentrated on a number of COVID issues over the past few weeks, as I have been doing, and that was tracking and interviewing positive COVID employee cases for employers in the town. I think I had about 10 of those that occurred in the past couple weeks. And then also responding to COVID-related complaints. Seems that a lot of those in this timeframe were related to proper mask wearing or lack thereof. So with that, I'll take any questions the board might have.
Christine?
Yes.
Mary
Please,
Beth?
Mary.
Oh, thank you, Mr. Chair. Just one, can you just share a little bit more information under your investigations on a compliance check?
Sure. At the address that's listed there,
Thank-
they had a non-compliance with the sump pump discharge regulation portion of our stormwater regulations. They were issued a violation letter, an order letter, and a fine. And then, as our protocol dictates, we do a follow-up inspection to ensure that the violation has been corrected. So I did that, and it had been corrected, and the fine was paid.
Thanks, Christine.
Sure.
David? Anything?
Nothing for me, Mr. Chairman. Thank you.
Ms. Sheehan? I have a couple things. Okay, thank you. If you think of something, please just chime in. I can't believe we're still finding septic systems out there. Were you surprised?
I was, and unfortunately, this individual has been connected to sewer since 1972. And they went to put in a patio, and lo and behold, they found an old septic tank that was never properly decommissioned. So I'm actually going out there later this week to witness the decommissioning of it.
And the next question we have is, I thought it'd be nice if you reviewed sub-slab depressurization systems.
Sure. As some board members may recall, on a few redevelopment sites in town, the board has, many sites, the board has required vapor barriers of some sort where there is known groundwater contamination that contains volatile organic compounds. And at some of those sites, the board has required what's called a sub-slab depressurization system, or an active vapor intrusion system be put into the design of the building. One such example would be the new convenient MD facility that was built on the corner of Terry Ave and Cambridge Street. These work to, much like a radon treatment system does in your home, and it works to funnel the vapors out of the subslab area, the area beneath your foundation, and vent it to the outside so you don't get the accumulation of volatile organics in the indoor breathing space within the building. As you may recall, a couple of meetings ago, this was discussed, or this was called, is sometimes referred to as a chimney effect. I think it was Mr. Ash, the LSP for the apartment complex proposed on Middlesex Turnpike, was discussing how that can happen in buildings. And this was, one of these was recently installed at 18 Terry Ave because they found indoor air quality concerns in an occupied space at that address. So they put in a temporary subslab depressurization system while they finalized design and installation of a permanent system. And the temporary system did abate the indoor air quality concerns. And so they're going ahead with a permanent system.
Will you be reviewing that system before the permanent system is installed?
Yeah, they'll submit the solution under the Massachusetts contingency plan requirements, and we are copied on that.
Good. Okay. I guess that's it. Do I have a motion to approve the environmental engineer's excellent report? Thank you so much, Christine.
Sure.
So moved.
Second.
A motion by Mary Beth Wells, second by David McSweeney. All in favor? David?
Aye.
Mary Beth?
Aye.
Andrea?
Aye.
And I vote aye, 4-0. Thank you so much. Now, the next report is the Director of Public Health. Now, there are actually 4 reports here. The first 3, the supervisory nurse, the health agent, and the associate health inspector, I'll ask our director to make any comments, and we can ask questions on those specific 3, those individuals, those professionals who are not here this evening. And then we will go to the Director of Public Health report. And so we will take them in 2 steps. So Susan, do you have anything special around the supervisory nurse, health agent, or associate health inspector?
Just that, as you can see from the reports, all of our staff is continuing to do their normal activities as well as work on COVID-related activities. We're kind of in a position where we need everyone pitching in order to get the work done. So that's why you'll notice it on everybody's report. Samantha Hardy is still currently assisting us with cases. One of the things for the supervisory nurse report is that she's also doing TB cases. So we have had a TB case come in. So she's currently working on a TB case, which also tends to take a lot of time. So that's it.
Thank you. Are there any questions for any of those 3 reports? If
None for
not,
me,
I
Mr. Chair.
thought I would just have one quick, just one quick note, and that is, even in the midst of the pandemic, in midst of COVID-19, we are still following Legionella cases, tuberculosis cases within our community, and other diseases that are reportable. So medicine and our disease situation doesn't take a holiday, even though there is a pandemic. So I would like well, I don't need to do that because it's a single, but now the Director of Public Health Susan, do you have anything to report on your specific entry?
Just a couple of things. So this week we have the second doses coming up for the Housing Authority clinic that we had. That's happening on Thursday. And just, for people out there who are wondering, we have the Moderna vaccine. We have Moderna is what we've been giving out all along. I'm sure you've probably heard in the news, the pause on the J&J vaccine. The message that Department of Public Health has said today is that they're not sure, how long that pause is going to be. It's currently being investigated by the ACIP. These 6 cases did not occur in Massachusetts. If somebody at home has gotten the J&J vaccine and they have questions or concerns, they should call their provider to answer those questions. Secondly, I just wanted to take a few moments to talk a little bit about isolation and quarantine and frequently asked questions, since we have seen a little bit of an uptick in the past week, especially with our schools and younger people. The parents have had a lot of questions, so I just kind of wanted to cover that a little bit. First of all, there was a lot of questions around close contact and what a close contact means. So a close contact is within 6 feet for 15 minutes or more cumulatively, regardless of the mask. So a lot of people think, well, I had a mask on, I'm not a close contact. That is not true. Hopefully the mask is going to provide a level of protection, but does not get anyone out of quarantine. You still are required to quarantine. Another thing that we're seeing is people are confused about who puts them on quarantine. So it is the Board of Health who puts people on isolation and quarantine. Sometimes, employers or coaches can give you information that you should be quarantined, that you came in contact with somebody who's positive, but you should reach out to your Board of Health to find out what the exact dates are. We don't want people running out and getting tested right away and saying, I'm negative, and then going back to their normal activities. People need to understand that the best time to get tested is 5 days after exposure. And then even when you're tested 5 days after exposure, you are not out of quarantine until day 8 after exposure if you test negative. People also should understand that the incubation period is 14 days. So the day you were exposed, you could become positive anytime within the next 14 days. We have had cases of people who have tested out of quarantine on day 5, went back to their normal activities on day 8, and then came down with symptoms and tested positive on day 11 or 12, and then had contact. So people need to continue to watch themselves for symptoms, even if they're out of quarantine. Also, we've had a lot of questions about sports teams. Well, I don't think my son or daughter was in contact with anybody. How are you deciding what's a close contact? So what we do when we have a case from a sports team, we look at the nature of the sport, and then we talk to the coach or an athletic director just to ask them what their procedures are and what happened. Were they at a practice? Were they playing a game? And take into account also what sport it was. So a sport like basketball will tend to have a lot more close contact than a sport like track and field. So that's just some of the questions that we've been getting. So if anybody has any questions on that, I'd be happy to answer it.
Okay. Mr. McSweeney, do you have any questions?
Not specifically on that, but Susan, I did notice in your report that you spoke with the fire chief about Northeastern University. I'm assuming it has to relate to the permit that they came in front of the board last meeting. Can you talk a little bit or update us on how that conversation went? Were there any concerns with, that split between Woburn and Burlington and how that all works out? Because I think there was a lot of discussion during the last meeting around that.
Yeah, so I wanted to make him aware that that they were doing, lab activities in this building, which he was not aware of. And he wasn't sure what would happen if they did call 911 from that building. He was going to look into that and get back to me as far as where would it go? Would it go to Burlington or would it go to Woburn? I think that still was unclear. And I did let him know that once we get the information, we'll have it at the Board of Health on file and we will share it with him. And Christine could probably give us an update on where we are in getting that information. Last I heard, they had said they were going to send it to us. I don't know if they had sent it yet. Christine, do you know that?
Yeah, I got that list late last week, and I was going to talk to you about it and share it with Chief Patterson. I also made an inquiry when I got the list from Northeastern because I was curious as to what the actual address for that building was. So the address for that building is 151 South Bedford Street, Burlington, because that's their mailing address. And there's actually a small corner of the building. The only thing there is like a corner of the entrance, but it's where their mail goes that's in Burlington. So that's their mailing address. So I was going to discuss that with you and the chief. I did ask Northeastern if they could also make that inquiry as to if somebody who was physically in that building called 911, where that call would go. I have not heard back on that, an answer to that question yet.
So that's great information, a great update. I appreciate that. I think, I'll rely on both Susan and Christine. I'll rely on you both to raise any concerns that comes out of that, because I think there was a lot of discussion last meeting as it relates to approving that permit, not knowing where the calls would go and what fire department would service that if there was a potential issue, which was my concern. And this is not a knock on Northeastern. They are, like I said in the last meeting, they are a great community resident, if you will, in organization within the town. They always have been. I support them being in here, and they've always done right by us. And this is not saying that they're trying to do anything against us. Again, we just want to make sure our I's are dotted and T's are crossed as it relates to the safety around those biological biological chemicals or agents and the lab work associated with it, and ensuring that when one of our first responders shows up or potentially shows up for an incident, that they're not unaware of what's going on in those buildings. So I appreciate that, and I'll rely on you both, excuse me, to ensure that if there is any concerns that you raise them at one of the board meetings.
And Susan, I'm going to just jump in for 1 second because it applies to this. If we have to go to town council, if we have no go to town council, I think we need to go to town council if this becomes an issue, because it's not going to be our firefighters with our address who show up. And if that's the case, I want to, if necessary, force Northeastern, and I don't think it'll be a force. I think they'll agree, but I'd rather take the authority over Woburn if we're going to have the address and our firefighters are going to be there. I do realize also that there's nothing going on in that building at this point in time, but at some point there will be, and I would just like to take the jurisdiction. I don't think Woburn will care. I just want to protect our community and protect our firefighters.
Yes, I totally agree. I was thinking the same thing, that the next step here would be to notify town council and ask them what happens when the address is in Burlington, but some of the building or most of the building is in a different town. So I will reach out to town council and get that answer and find out, should they be applying to us for a permit?
And if so, we can discuss whether they need to come before us or not. But it's key that we protect this community. Thank you. David, are you all set?
Yeah, I'm all set. Thank you, Mr. Chairman.
Mary Beth, anything?
Yes, thank you, Mr. Chair. Susan, do you think I saw in your report that you're reviewing some resumes for the assistant health director? Just if you could just give us a little status of that and how that's been going and that you've been receiving for that position?
So there is a subcommittee for that. So myself, David and Ed, yep, and the resumes have been given to all of us. They currently, the whole subcommittee has all the resumes that have been sent to us to date. And we're just waiting for next steps, and I'm not sure. I think what we need to do is maybe have a conversation with the subcommittee about next steps.
Great.
Yes, I think that the subcommittee needs to meet either the next week or the week after. We do have a couple of potential applicants, but as a whole, Mary Beth, I can tell you, nothing to write home about at this point in time. At least that's my personal opinion, in terms of having everything we want. Now, I'm not sure that my colleagues feel the same way. I have no idea. But I can tell you that it's going to be a tough find. It's going to be a tough find to find somebody who fits all of the criteria that we're looking for.
Yeah, I would agree. And just a quick update, and Susan, I agree. I think we need to probably meet over the next couple of weeks as a subcommittee. I do think, Ed, and I agree with you. I think, gosh, I don't even know how many, 50 plus resumes. There's probably 3 or 4 that were worth talking to. And that's probably a stretch in itself. But, I think it's going to be a tough haul trying to find the quality of candidate that we established with town meeting that we wanted to find. But again, I think we need to get back together as a subcommittee, see if we want to talk to those 3+ candidates and what the next steps may or may not be.
It took the school department months and months to find a diversity director. It's going to be hard, especially through this pandemic. I did get on the Curry College and discussed with Curry College. They invited us to a candidates night, and it was not necessarily what we really were looking for. It was mostly for new people and for nurses, but specifically clinical nurses. So that didn't work out very well.
And if it has to come in, discussion for another meeting, is the subcommittee working with local colleges that offer public health programs? But you're looking for someone with a little bit more experience, is that it?
Yeah, we're looking for somebody with public health experience
Yep.
and biotechnology.
Yep. I
That's
did
what
look
we-
at the description. Yeah, okay.
Uh,
Okay.
Thank you, Mary Beth.
No,
Thank you for those
thanks for
questions.
the update. Thank you so much.
Ms. Sheehan, Andrea Sheehan, our new member, do you have any questions for our Director of Public Health?
No,
She
I
does-
don't.
She does
No,
not.
not this time.
Thank you. Susan, you went to a meeting of town reopening status and town leadership. Can you give us a quick update on what's going on?
Sure. So that a group includes myself, Town Administrator Paul Sagarino, Assistant Town Administrator John Denizio, Facilities and Superintendent of Public Works John Sanchez, and Human Resources Joanne Faust. And the discussion was, we've been meeting all along just to so that we can have strategies for what happens when someone tests positive, what protocols should be set forth in place for the town offices, what are the standards for the offices. This particular meeting, we talked about when the town building should reopen, and it was kind of the conclusion that we were going to hold off for a little bit and meet again when things seem to improve a bit. So right now, the town offices are still closed, but the public can call any department that they need to call or go to and make an appointment. There are also drop boxes outside of each of the town buildings if people need to drop something off. So the buildings and the staff are accessible. It's just that the buildings themselves are not open for the public coming in
Thank you.
without an appointment, I should say.
No other questions. Thank you so much, Susan, for all that you do, and for all our staff, Sarah, Susan, and Christine. Thank you for all that you do. If there are no other questions, Do I have a motion to approve the Director of Public Health report, and that includes the supervisory nurse, the health agent, and the associate health director?
So moved.
I have a
Second.
motion by Mr. McSweeney, second by
Mary Beth.
Mary Beth Welch. All in favor, Mr. McSweeney,
Aye.
Mary Beth Welch,
Aye.
Andrea Sheehan,
Aye.
and I vote aye. That's 4-0. Thank you so much. That takes us to the end of this meeting. Is there anything else that anybody would like to bring up or like to see on our next agenda? Please feel free to let our Director of Public Health or myself know.
Mr. Chair, can I have the floor for literally 30 seconds, if you don't mind?
Please.
Yeah, and I couldn't state this when you were making your your tribute to my dad because I was choking up too much, but I do appreciate your thoughts and sentiments, and everybody on the board. He did love this town more than anybody, and he moved here back in '64, and loved this town for what it was, and loved the town politics, and certainly after 37 years, truly loved the Burlington Board of Health. And again, he thought for sure that all politics was local, that you help your citizen, your neighbor, and he did so, with authority and steadfastness, and behind the scenes. And and I said this the other day during his memorial mass that now that I'm involved in town politics, I get these occasional folks that come up to me and say how much they loved my dad, and I said, I will say to them, are you, and one comes out in particular, but I say to them, you were a friend of my dad's. And he said, no, I didn't really know him. I just had an issue, so many years ago, and I called him out of the blue, and he was steadfast in helping with me with that issue in town. And my dad never wanted the accolades or the recognition. So I appreciate you taking the time, Ed. He loved you. He spent 20 plus years on the board with you. He started out in the Board of Health when it was a 3-person board. It wasn't even a 5-person board. And he watched the town grow from really from a pig farm, chicken farm to what it is today. And he truly loved this town as much as anybody. So I thank you for your tribute and your comments. And thank you for the town for what they did to really celebrate his life, as he did live life every single day. So I just wanted to take the time to thank you for the comments, because I couldn't earlier because I was too choked up, but I appreciate that.
Thank you so much, David. Anything else from either of our board members? If not, in closing, the COVID-19 pandemic's still here. We've got to remain vigilant. We got to keep our guard up. We got to wash our hands. We got to wear our masks. We got to social distance. And we got to do what we need to do to beat this disease. With that, I entertain a motion to adjourn.
So moved.
Motion by Mary Beth Welch, second by
Second.
Andrea. Why don't you second this? You'll be a first.
There you go. Your first motion.
I second it then.
Second by Andrea Sheehan. This is no other comments or discussion. All in favor, David McSweeney,
Aye.
Mary Beth Welch,
Aye.
Andrea Sheehan,
Aye.
and me, and I vote also aye, 4-0. Good night, everybody. Be careful, be safe, be well. Good night.
Good night. Thank you, everybody.
Bye.